You look at your hands dozens of times every single day. You type with them, you eat with them, you check your phone with them. And right now, sitting at the base of your fingernails, there is a biological readout your body has been broadcasting for years, and you have been staring directly at it without knowing how to read a single word. Those small white half-moon shapes just above your cuticles are not decoration. They are not random variation. They are a live window into your cardiovascular system, your thyroid, your bone marrow, and the rate at which your body is building its own cellular architecture. And the information they carry can appear on your skin months before a standard blood test flags the same problem. In this video, we are going to decode every signal your nail moons are sending, what it means when they disappear, what it means when they grow abnormally large, what color changes signal in terms of urgency, and which specific fingers show the earliest warnings. By the end, you will never look at your hands the same way again. The white half-moon at the base of your nail has a medical name, the lunula, from the Latin word for moon. It sits just above the cuticle, and it is the visible portion of your nail matrix, the biological factory where your nail is actively manufactured around the clock. Think of it as the loading dock of a construction warehouse, operating 24 hours a day. Every nail cell your body produces starts inside that matrix, and the lunula is the section of that factory floor close enough to the surface to be seen through the nail plate above it. The reason it appears white is not pigment, and here is where most explanations get it wrong. The lunula is not white because anything is blocking the blood beneath it. It is white because the cells in that active manufacturing zone have not yet completed the keratinization process, the biological transformation that turns soft, opaque matrix cells into the hard, transparent nail plate. Those immature cells scatter light differently than fully keratinized tissue. They are not transparent. They cannot let the pink of the underlying blood vessels show through the way the rest of the nail bed does. What you see as white is a zone of cells still mid-construction. It is your body in the act of building itself, visible through the skin. Here is where it becomes critical. The size, shape, visibility, and color of your lunula are not fixed. They change with the state of your internal systems. Nail changes, including lunula abnormalities, are recognized in clinical dermatology literature as underutilized early diagnostic markers. Physicians trained in nail morphology identify systemic conditions including hypothyroidism, anemia, cardiovascular disease, and autoimmune disorders from nail presentation, often before other symptoms become obvious. The field that studies this systematically is called onychology, and the signals it maps are real, documented, and written on your hands every single day. You simply did not know the language. The first thing most people notice when they start paying serious attention is that some lunulas have disappeared entirely. You look at your hand and see a sliver on your thumbs. The moons on the smaller fingers have retreated completely beneath the cuticle edge. This is called lunula recession, and the mechanism is a reduction in nail matrix cell proliferation. The biological construction activity in that zone slows down. The cells produced are fewer, and the visible arc withdraws. Think of your nail matrix as a factory running on a budget. When resources are cut, the first departments to be scaled back are the ones farthest from the core operation. The lunula does not disappear because your nail is structurally damaged. It disappears because the cellular activity that maintains it, cell division, protein synthesis, tissue renewal, has been reduced by a systemic change in the body's resource allocation. The most common driver of that reduction is iron deficiency. Your body uses iron to produce hemoglobin, the protein inside red blood cells that carries oxygen to every tissue. When iron stores fall, oxygen delivery to peripheral tissues, including the nail matrix, drops, and matrix cell activity slows. The World Health Organization estimates that iron deficiency is the single most widespread nutritional disorder on the planet, affecting approximately 800 million children and women globally, with iron deficiency anemia specifically impacting an estimated 600 to 700 million people worldwide. The majority of those people have never connected changes in their nails to an iron delivery problem that has already been running for months. The second major driver is hypothyroidism, an underactive thyroid gland. Your thyroid produces hormones that regulate the speed of virtually every metabolic process in your body, including cell proliferation and protein synthesis. When thyroid output falls, cell turnover throughout the body slows. Keratin production, the structural protein that nails are made from, slows with it. Nail growth rate decreases and nail matrix activity diminishes, which directly reduces the visible size of the lunula. The American Thyroid Association estimates that approximately 20 million Americans have some form of thyroid disease, and that roughly 60% of them are entirely unaware of their condition. They are fatigued, cold, losing hair, gaining weight, and no one has connected those symptoms to a gland the size of a butterfly that has been quietly throttling down for years. The lunula shows the slowdown before most other signs become obvious. Now here is the misconception that gets people badly wrong. You assume that large, prominent, dramatically visible lunulas mean your body is operating at peak health, that the bigger the moon, the more vital the biology. That assumption is where people misread a warning as a report card. Abnormally enlarged lunulas, ones that extend far beyond the cuticle edge and cover more than a third of the nail plate, have been reported in the medical literature in association with cardiovascular conditions and hypertension. Case observations published in dermatology journals, including work cited in Cutis, noted this correlation in clinical settings. The precise biological mechanism behind this association is not yet fully established, but the working hypothesis involves vascular changes in the peripheral capillary bed that alter how much of the matrix tissue is visible through the nail. What is established is the clinical observation itself, abnormally large lunulas that represent a change from your personal baseline are worth investigating, not celebrating. This is the biological villain that wears the costume of strength. Large, visible, prominent lunulas feel like something to admire, but when those moons appear noticeably larger than they used to be, when you compare your hands now to photographs from years ago and see the expansion, that change is worth bringing to a physician. Your nails are showing you that something in your vascular system has shifted. If size changes are the slow signal, color changes are the urgent alarm. A healthy lunula is white or very slightly off-white. Any deviation from that baseline is a clinical flag. Blue lunulas, a finding called azure lunula in the medical literature, are among the rarest and most serious presentations in nail medicine. They are most strongly associated with Wilson's disease, a genetic disorder of copper metabolism in which the body cannot properly eliminate copper, causing it to accumulate in the liver, brain, kidneys, and other organs at toxic concentrations. The copper buildup alters the appearance of the tissue visible through the nail, producing a distinctive blue-gray tint in the lunula arc. Wilson's disease is frequently diagnosed late because its early symptoms, fatigue, mood changes, difficulty concentrating, tremor, are attributed to other causes. The lunula is one of the few locations where copper accumulation can be inferred from visual inspection alone, without biopsy or imaging. A blue tint in your lunulas is not a variation to observe casually. It is a reason to see a physician and request copper and ceruloplasmin testing without delay. Red lunulas carry a different profile. They are documented in association with cardiovascular failure and autoimmune conditions including alopecia areata, lupus, and dermatomyositis. In the context of congestive heart failure, the redness is thought to arise from venous congestion, the backup of pressure in the venous system reaching the peripheral capillary beds, including those at the nail matrix, causing the underlying tissue to appear red or pink through the nail plate. In autoimmune disease, the proposed mechanism involves microvascular inflammation altering the capillary architecture at the matrix. Red lunulas have been documented appearing in some patients before other systemic symptoms become clinically apparent, which is precisely what makes them worth knowing. Here is the part nobody talks about. Not all fingers carry equal diagnostic weight, and the order matters. In most healthy adults, the lunula is largest and most reliably visible on the thumb. It decreases in size progressively across the fingers, index, middle, ring, and on the pinky it is often so small that it sits entirely beneath the cuticle edge. This size gradient is normal. When lunula recession begins, whether from iron deficiency, thyroid suppression, or another systemic cause, it follows that gradient in reverse. The smallest lunulas disappear first. The pinky and ring finger lose visibility before the middle and index fingers show change. The thumb is the last to be affected. This means that if you are monitoring yourself, the most sensitive early warning appears on your ring and pinky fingers, not your index or middle. And then there is the inversion, the finding that goes in the opposite direction. If you have a clearly distinct, visible white arc on your pinky finger without pressing the cuticle, that presence, where absence is the norm, is a clinically noted finding. Observations in the dermatology literature have reported an association between a visible fifth finger lunula and systemic hypertension, with the proposed explanation involving vascular tone differences that affect how the matrix tissue presents in individuals with elevated blood pressure. The pinky is the canary. When it shows what it normally does not show, that signal deserves attention. Now, here is where people hurt themselves with this information. The most damaging mistake you can make after learning to read your lunulas is falling into what we call the diagnostic spiral trap, attributing every minor change to serious disease, obsessively examining your nails every morning, and generating chronic psychological stress from the monitoring itself. This trap is biologically counterproductive for a clear reason. Chronic psychological stress drives sustained elevation of cortisol. Chronically elevated cortisol is documented to inhibit TSH secretion and impair the conversion of T4 to the active T3 form of thyroid hormone. Reduced effective thyroid signaling slows cell turnover and keratin synthesis throughout the body. Over months of severe chronic stress, the kind associated with persistent sleep disruption, prolonged anxiety disorders, or major psychological trauma, these effects are measurable in nail and hair changes. This is not a cycle that acute monitoring anxiety triggers overnight, but it is a real physiological pathway, and it is a reason why the correct approach to lunula observation is disciplined, periodic, and calm, not daily, anxious, or compulsive. The correct response to any change you observe is documentation and investigation, not alarm. Here is the lunula assessment protocol, done correctly in 3 steps. Step 1. Environment. Assess under natural daylight with clean, unpolished nails. Hands should rest palm down on a flat surface without muscular tension. Artificial light alters the apparent contrast between the lunula and the nail plate. Any nail polish, clear or colored, masks the lunula. Hand tension changes cuticle position, hiding or artificially exposing the arc. Step 2. Documentation. For each finger, record 4 variables. Is the lunula visible at all, or has it retreated beneath the cuticle? What fraction of the nail plate does it cover? What is its color? White, blue-tinged, red-tinged, or yellowed? Has this changed from your previous baseline? Take a photograph. Memory distorts over time. A photograph under consistent lighting gives you something you can actually compare against in 3 or 6 months. Step 3. Cross-reference your symptoms. Lunula changes in isolation are a reason to investigate, not a standalone diagnosis. They carry the most clinical weight when combined with other findings. Unexplained fatigue combined with lunula recession across multiple fingers points toward iron deficiency or thyroid dysfunction. Unexplained palpitations combined with newly enlarged lunulas points toward cardiovascular evaluation. Joint pain combined with abnormal lunula color points toward autoimmune workup. The nails are the alert. Your symptoms provide the context that directs the investigation. When you bring this to a physician, the appropriate initial laboratory panel includes a complete blood count to evaluate for anemia and assess red blood cell morphology. A ferritin level, not just serum iron, because ferritin is the far more sensitive and specific marker for total iron stores, and serum iron alone can be normal even when iron reserves are depleted. And a full thyroid panel that includes TSH, free T3, and free T4. TSH alone is insufficient because subclinical and peripheral thyroid dysfunction can produce measurable changes in tissue-level thyroid activity with a TSH that appears within the normal reference range. If blue discoloration of the lunula is present, copper and ceruloplasmin levels are essential additions to that panel. You are allowed to bring your nails to your appointment as clinical data. Most patients never mention nail changes. Most physicians do not examine nails unless something is visibly severe. You are not most patients. Your body does not malfunction in silence. It signals, it flags, it broadcasts the state of its deepest systems on the surface of your own skin, every single day, within eyesight, every time you look down. The lunula is one of the most accessible of those signals. It is visible, free, always present, and overlooked by the overwhelming majority of people who see it daily without reading a word. You are no longer one of those people. You know the order in which fingers show early recession. You know what color means urgency and what color means call the doctor today. You know the trap that turns calm observation into a physiological problem. You have the map. Look at your hands right now. Count how many fingers have a visible lunula and drop that number in the comments. Your hands have been talking. Now you know how to listen.